plastic surgeon, Dr. Stephen Teitelbaum. Thank you so much for being here.
It's my
Doctor,
pleasure.
tell us what was the deal when Denora came to see you?
Well, when Denora saw me, she was very upset and scared that she had a deformity that could not be corrected. But fortunately, it's something that can be fixed. So our whole initial visit at least ended on a positive note.
So she had had surgery before. She had had breast augmentation?
She had had a revision of a breast surgery, actually by a gynecologist, and she was left. Yes.
So wait a minute, a gynecologist performed plastic surgery. They were not board certified to do so.
They were not board certified. Most patients, most people, everyone in the audience, you're surprised you don't have to be board certified to do surgery, right?
Yeah,
well,
yeah, I am.
You have to have a plumber's license to do plumbing. You have to have an electrician's license to do electricity. But the state gives one medical license for all doctors, and then it's up to each patient to be sure that their doctor is actually board certified.
And so what does the difference mean? Board certified is that they've done a certain amount of procedures like that to get this kind of credential?
Yes. It means that they have done an established training program, they've taken exams, they've had rigorous education, they keep their boards up to date. Like in plastic surgery, it's the American Board of Plastic Surgery. It's the only board. So if you're looking for plastic surgery, American Board of Plastic Surgery. And if you're looking for aesthetic surgery like Denora had, then you just need to go to surgery.org. It's that simple. That's the American Society for Aesthetic Plastic Surgery. And everybody on there specializes in aesthetic surgery. Their license is up to date, their CME is up to date, their board certification is up to date. So with surgery.org, you'll be safe.
So certainly when you're doing, elective surgery, you need to do your due diligence and find a good practitioner.
Yes.
Okay, all right. Let's meet Denora, who went in for a cosmetic surgical procedure after one of her breast implants leaked. What she awoke to in the recovery room was far worse. Please help me in welcoming Denora. Thank you for being here. Thank you for sharing your story, because you are the cautionary tale. So you went to a gynecologist to have plastic surgery? What were you thinking in the first place?
I didn't know this. A friend of mine recommend me to her. So since I saw her with the white dress,
coat, right?
I thought, she's a doctor, she knows what she's doing, and I just trust her.
So you went because you had had breast implants and one of the implants was not, was deflated? I don't know what the terminology is.
No, I just went because I wanted to have my implants checked, see if it was time to replace them. And she told me I needed to have a mammogram done. So then she gave me the results, and she told me one of the implants was leaking, which we found out later that it wasn't true, that she lied to me. So she told me I need surgery right away, and that's when I decided.
So she did the surgery, and what was the result of the surgery?
I end up with almost just one breast. And the worst part is that
oh, so the implants kind of came together and there was no separation. Is that what
yes, exactly.
Okay, so what did you think? What did you do after that?
I was in shock. I couldn't believe what had happened, and since the moment I woke up from the surgery room, I knew something had gone wrong, because I was experiencing a terrible pain. I couldn't move my arms, I couldn't move my body, and the worst part is that when I woke up, I couldn't open my eyes. She had done a surgery also in my eyes without my permission, so that was the worst part.
Wow.
And I was like in shock. I want her to give me an explanation, and she wasn't even there in the room anymore.
So how did you come to find Dr. Teitelbaum?
I was searching with the different surgeons to see if there was someone who can help me with my problem, and after I see different surgeons and they told me they were afraid to try to fix my problem, I found Dr. Teitelbaum by the internet.
And so tell us, Dr. Teitelbaum, what did you have to do? What was the issue with her breasts?
Instead of the left implant being behind the left breast and the right behind the right, the two were connected and touching in the center. So I just put the right on the right and the left on the left. I separated them, and she was fixed. Okay,
and are you happy with the results?
With what Dr. Teitelbaum did, yes.
So what would you 100%. Say to those of us out there that are thinking we want some plastic surgery? What would you say?
My advice is that before you go to a surgery room, make sure you research this surgeon and make sure he's a certified doctor, because you never know how you're gonna end up looking after you came from.
And I'm guessing plastic surgery, word of mouth is best, right? You wanna see someone, you wanna see their results, be happy with what you see, and then ask them who their doctor is.
But look, your friend doesn't always get the best doctor either. She had her referral from a word of mouth, so you still have to go to surgery.org. Be sure that it's a board-certified plastic surgeon.
All right, and also you don't want to do it on sale. You don't want to buy on sale with this stuff. You get what you pay for, right? All right, thank you so much for sharing your story, and you look beautiful.
Thank you,
Dr. Teitelbaum. Coming up after the break, a controversial procedure more and more women are having to look less ethnic. Find out who's doing it and why after this break.